based on the scientific evidence, we wouldn't expect there to be any public concern. I think it has then the characteristics of a scare, because what we're seeing is the use of emotionally charged terms like chemical burn and pictures that make parents fearful, as opposed to actually people who are trying to provide them with good information and help them really understand what they need to do to make their babies have a better experience. The Consumer Product Safety Commission actually investigates a lot of safe products, and in this case, they might be investigating Pampers with Drymax because they've heard some consumer complaints and they want to make sure that they have all the available scientific evidence and that they can reassure consumers about what's going on. It's really pretty simple in the sense that whenever something is brought to their attention, they look at it because, just like the companies, they take consumer complaints seriously. I think the thing people need to realize is, even though it sounds pretty scary when you hear the media talking about a CPSC investigation or something like that, it doesn't mean that there's anything wrong. I think parents don't realize how much consumer testing has been done to bring the product to market. And in fact, the experience that the company has had with testing the product before it even got out onto shelves is really extensive. One of the things that I think is really important to know about the consumer testing data, which reflects hundreds of thousands of baby uses, is that parents are reporting the same number and same types and same experiences with diaper rash with the new product as they did with the old one. And that's not the perception that comes through when you look at what's going on Facebook. The evidence that we've seen so far suggests that Pampers with Drymax is not causing any difference in the experience that parents are having with diaper rash, period. They're not seeing different types, they're not seeing different severity, and they're not seeing more or less. It's basically the same. The challenge is that when you introduce a new product like Pampers with Drymax, parents see rash and they say, I have a new product, maybe that's the cause. But when you look at the overall safety profile and the consumer data that the Pampers with Drymax team has collected, it's very clear that the relationship is not there.